Perspectives in Oral Health is a presentation of Tufts University School of Dental Medicine's Office of Continuing Education. Join us as we engage with leading experts, healthcare professionals, and thought leaders to unravel the latest advancements in science, dentistry, and the interconnected relationship between oral health and overall well-being. Without further ado, here is your host, Dr. Imran Ahsan.
Hey everybody, welcome back to the Tufts Perspectives in Oral Health podcast. As always, I'm your host, Dr. Imran Ahsan, and today I have a Tufts alumni, Dr. Jeremy Krell, who's going to tell us about his journey. He is actually the co-founder of Revere Partners, which is doing a lot of interesting things in the dental space. Jeremy, tell us a little bit about your journey and how you got to where you are.
Yeah, first of all, thanks so much for having me on the podcast. So by way of introduction, there's kind of two parts to me. There is the clinician academics half, and then there is the sort of professional side, right? Meaning the business side. So on the clinical side, yes, I practice dentistry. I helped a few practices grow and scale and turnover. In addition to that, I've been involved in the academic world. I sit on the board of a dental school now. In addition to that, I hold some roles at the American Dental Association and Massachusetts Dental Society. On the business side, I'm really a startup guy. That's sort of how I brand myself. In terms of startups, I was in tech first, having nothing to do with healthcare at all. Pretty young, I had ventures in luxury goods and commodity services, web and graphic designs. I exited those businesses. I started and ran an incubator while in dental school. So first in Boston, then expanded it to New York, Chicago, San Francisco. After that, accepted a leadership role at Oscar Health Insurance, and we IPO'd. I went to Quip, the subscription electric toothbrush company, became the dentist behind that. It became a VC-backed unicorn business. I exited from it, and about 5-6 years ago founded Revere Partners, which is really the first VC fund focused on investing in dental technology. So kind of closing the gap between oral and systemic health from a tech perspective. So I sort of went from dentist or clinician to startup guy to startup investor, specifically within oral health. So that's kind of my pathway, a bit non-traditional. But I don't regret any of it. It's been fun. I've learned a ton.
I love that your focus is the gap between oral and systemic health. That's something I'm super passionate about, especially being in oral and maxillofacial surgery. I feel like it's part of our DNA, and I love that more people are talking about it. But realistically, I see that the change is not happening fast enough. And if there was one place where I think is driving change in general, it's industry, right? It's not so much academics, it's industry. So like, what are you seeing that are the trends from your perspective in, how dentistry is changing? And also, how do you think that dental practice is going to be different for the graduates from Tufts University this year?
Yeah, so I'm going to give you a couple different looks at this answer, a high level look first. So dentistry is along this curve of transition from where, I think it was even as recently as 10 years ago, right? Maybe even more recently than that, but it's in this phase of really what I'll call analog dentistry, right? You're talking about paper charts and wet x-rays and things like this, right? It then has slowly started to graduate and evolve into what I'll call, if we want to go dentistry 1.0 was analog dentistry 2.0, which is digital dentistry, right? Really starting to digitize x-rays, digitize charting, and kind of more focus on data, right? And normalizing data, warehousing data, communications and patient engagement being digital, right? And then the third wave, which we're sort of starting to enter now, is dentistry 3.0, which is connected dentistry, right? How do we now make ourselves a part of the healthcare system? How do we empower patients with their data? How do we connect better as professionals to treat the patients better and drive better health outcomes? How does the payer system work in a way where it's not just gone digital, but it's actually in the loop and more aligned with both the way providers want to practice and also patient care? So we're along this kind of curve of dentistry 1.0 to 2.0 to 3.0. The issue is the trend of consumerism and the trends in healthcare, systemic health outside of dentistry are ahead in this curve compared to where we are. Consumerism is way ahead in this curve, right? Patients come in the office expecting to, tap their phones or, do very quick modes of payment, for example, and we're still talking about insurance, and I don't know how much they're going to reimburse. And some days I feel like somebody's going to pull out a carbon copy of my credit card if the payment processor is not working.
Yeah.
Right. So there's a gap there, right? In terms of where the consumers are, and then even in healthcare, there's quite a few innovations that are accepted in that system, not because healthcare is different from oral health in this regard, but because they're just ahead. So something like, for example, the Da Vinci robot, or even some use cases for AI are long since accepted, right? I haven't seen a robot take any neurosurgeon's job or orthopedic surgeon's job in medicine. You don't see AI replacing people, and there being enormous kind of backlash from the workforce for that reason, right? And so we're trying to adopt those principles here. There's very early onset of robotics, for example, in dentistry. There's certainly some use cases of AI, but we are starting to adopt it more. We're building this mentality of it isn't the AI or robot that's going to replace a provider. It's the provider who's using AI or a robot that's going to replace a provider that's not, right? It's always the provider in the loop, and we're just sort of coming to terms with that in our industry. So from a high level perspective, that's where we are going from, sort of this analog world to digital world to connected dentistry. On a more kind of detailed level, where are the tech trends now that maybe we're investing in as a VC fund, or that graduates are likely to see when they walk into the practice environment? There's a few that are really coming out and that kind of stick out in my mind. You're seeing, right, the dentist is a business owner when they graduate right away, right? So take that practice management course seriously, and know that you need to learn a lot more than that to really run a business. There are some now what I'll call kind of business intelligence tools. Some of them are normalizing data or helping you to understand data better, but let's call it business intelligence tools now that have come out that are really starting to change the way that a practice can respond to data inputs and outputs in their practice, right? Sort of in the business world akin to business intelligence tools that sit on top of CRMs. Instead, we have customer relationship management tools. Here in dentistry, we have practice management systems, and on top of it, these sort of custom versions of business intelligence tools that can help us understand, well, what patients came in that are available on Tuesday, that are approved for and treatment plan for a crown, with the insurer being able to pay for a crown, right? So that you can line up all the data that it takes to bring that patient into an appointment on Tuesday afternoon. Right. So there's those kinds of tools that are coming out. We're seeing a huge focus on oral systemic health linking. There's a lot of work being done on chronic disease states like periodontitis and its multitude of ways that it connects to systemic health, all the way to the microbiome. So there's a number of different chairside diagnostics, biometric tools, continuous monitoring tools that are coming out that is going to be more commonplace in the practice. For a dentist, in my personal opinion. So that is on the way.
That's what I want to hear about, is like your personal opinion on how the culture of dentistry is going to shift, because some of the trends that you mentioned, like the transition to digital technology, right? A lot of that has to do with a great product. Like when you had a really great intraoral scanner, all of a sudden massive adoption, right? Like the iPhone. You come out with a great product and all of a sudden it changes the culture, right? Do you see that happening with biologics like that are connecting oral and systemic health? Do you see that happening with there's a woman at Tufts, Pamela Yellick, that's like making teeth in jars, like, is that the future of dentistry, or is it going to be, something more akin to like the dentist kind of managing a whole bunch of like AIs and digital? Like, how do you see a lot of these things playing out?
Yeah, I think first of all, the dentist in this world of dentistry 3.0, to my previous analogy, is a dentist who is responsible for more than just clinical dentistry. There's nothing wrong with that, by the way. But I think the shape of a lot of our profession is going to become, well, I'm responsible for some business
you mentioned Quip, which is something that I feel like I had used it for a second, but now they're doing like diagnostics with the toothbrushes and everything like that. You get
That's
a
right.
breakdown of all of your stuff, which I think is so interesting. And the family members that I do expose to that, they're interested in it, but it hasn't gotten that mass penetration, right?
Yeah.
And so like, how do you think that that's going to happen? Like, how do we make that happen through industry?
Yeah. So I think there's a few answers here, right? I think on the industry side, the movers and the shakers, right, to list them out, they're the manufacturers, they're the distributors, the insurers, the DSOs, the professional associations, the labs, the retailers, and maybe the private equity funds, right? Those are really kind of the 8 pillars of dental industry. Insofar, I'm sorry if I left anybody out, right?
No, that's
probably academics, for example,
that
deserve a pillar.
Yeah.
But these are the 8 or 9 or 10 major pillars of industry that are driving change. And so there has to be change driven within each of them. I also agree it's going to come from dental, right? It's not as if the rest of or most of the medical profession, even where there is a link, is coming to dentistry, right? And saying, hey, there's this Alzheimer's link. Let's figure that out, dentistry, and we want to work with you. No, it's going to be driven probably by the dental profession to come in, right? So I think that's a key component. There are biologics that some of them are dental focused and some of them cross the borders into oral systemic health. I'll give you an example or a few examples. One of them, Keystone Bio, a company we invested in, right, specifically focuses on knocking out P. gingivalis. And there's been a few other companies out there to focus on that. Its gingipanes are crossing the blood-brain barrier. They are found in a tremendous number of Alzheimer's patients post-mortem, right? It is a huge problem in precipitating Alzheimer's-like plaques in the brain. So we have to focus on things like this. There's other companies out there who are taking more of an approach on periodontitis and the rest of the inflammatory cascade that it has, right? In particular, for example, a company, Flightpath. We're not invested in that company, but they're knocking out fusiform bacteria, spirochete bacteria, right? They're taking two legs of the stool and knocking them out, right? In that red complex and that orange complex that we learn about. There's companies we invest in that do cross the borders, right? There are a company Boston-based Rev Bio, for example, which came out of Mass Challenge. This company has a regenerative capability. It acts as an implant stabilization, right? But it was first founded in its first indication for use was really in cranial flaps. And then it came to the spine. And then it came to dental implant stabilization, right? So there are these cross musculoskeletal sort of applications to the industry, right? So there's companies in microbiome we invest in, like Viome, Bristle Health, and so many, Lura Health, who are doing everything from continuous monitoring to oral cancer screening like Oris DX to microbiome screening and testing like the others that I mentioned that have such an impact on the gut, right, and the rest of the body. So there's these companies. The role of the dentist is starting to adopt a bit more the diagnostics and the prevention. This has always been there, right? It's not as if we haven't seen ourselves as a diagnostician, right? But we are stuck in a reactionary system, right? We are not being proactive. We are reacting, and that there's a lot of reasons for that. Payers, for example, have not largely supported some of the preventative, measures or necessarily the diagnostic measures if it doesn't make business sense on their side. So we have to find those alignments there, right? And we have to get somebody to pay for these things so that they can be done ideally, quickly, accurately, chair side, right? And we can find these problems and we can find them early, right? For a difficult problem there is oral cancer. It's a relatively low incidence cancer compared to other cancers, but that means we find it at stage 3 and stage 4, and that's a problem, right? Those people have a lot of comorbidities at that point and a difficult prognosis sometimes in order to treat that, right? But on the other hand, who's going to pay, right? Because the dental insurance company, it would only really be paying for, primarily involved in some of the upfront costs, right? The diagnostic, maybe some of the more dental related treatments, but a lot of the cost is actually going to be borne, if that person needs greater, treatment, they need surgery, they need radiation, they need chemo, they need, other types of treatment, that's going to be borne, that cost is going to be borne by the medical insurance company. So how are we going to solve that problem there, right? Where somebody's paying for the test, there's going to be a bunch of negative tests because it's low incidence. and the rest of the costs are being borne by somebody else. We've got to have a way for medical insurers, dental insurers to work together. And so we've participated in the Oral Cancer Summit with the American Dental Association to bring American Medical Association, American Cancer Society, the oral surgeons closer together to solve difficult problems like that. So it's gonna really require collaborative efforts, kind of like a tumor board would for treating a patient with a complicated oral, head and neck cancer or prognosis. So it's going to be multi-stakeholder.
Yeah, I mean, that's interesting that you say that the dentist is going to have a role of kind of like a diagnostician more so than a clinician, because I see a lot of that stuff coming out with salivary testing and some of these more systemic tests that may be outside of the wheelhouse for a lot of these general dentists to adopt. And certainly, I don't see that being as much of a priority in the dental school education. Do you think that, especially with your background in dental education, do you think that that's something that's going to change, or is this something that's going to happen after dental school? These people are clinicians, and then it becomes this thing that you do sort of after the fact, like through continuing education and something.
Yeah, look, that's part of the reactionary system problem there, right? Is, dentists learn, and there is a part of dentistry that's continuous learning. There's always advancements in science and technology. Eventually, whether or not it feels like it to the dental student, they are graduating from dental school. And so there will be, technology investments 5, 10, 20 years after, and beyond they graduate, and they will need to learn about some of these in continuing education. But I do feel that the diagnostician component, right, really does need to be focused on in dental school. They really do need to understand this is really not a microbiome class as much as it is what can I do in a practice environment, right? Specifically in a practice environment, and what can I do chair side to a patient to better get a full picture of what this patient's care plan really needs to include, right? And I don't feel that to date, we've necessarily covered some of those areas as a core focus to dentistry, right? I'll tell friends and colleagues who are non-dental that, hey, occlusion and TMD and some of these higher end cosmetic procedures, and we don't actually really focus a lot on that in dental school, right? And their eyes kind of bulge out of their head and they sort of say, 4 years and all that cost, what do you focus on, right, in dental school? And we've been very focused on doing, running the exam and the science that goes behind the exam, and right, the fillings and the crowns and the root canals and the how-to a lot of the, minor and major dentistry, right, procedures. But if the role is shifting to higher indexing on diagnostician, and it's also indexing to, providers focusing more on those fully restorative and full mouth cases, and the other types of dentistry in the middle is really almost more supervised care at a certain point, right? Maybe there's robotics, maybe the role of the hygienist changes, right? Maybe there's other evolutions or innovations that happen sort of in the middle, right? The dentist's role shifts there, right? It becomes, I need to know about my business. I need to know about the technology that's being used here. I need to be the best, sort of diagnostician focused on prevention and minimally invasive care if I can, and treatment planning where I need to. And then I need to be really involved in fully restorative care on the other side of things, right? That role changes a lot from what we're teaching today, right? Again, I'll emphasize teaching in the practice environment. Many of us in dental school learn in a hospital-based, system. But if you're not going to practice in a hospital-based system, that student has to make a big jump to what does it look like in a practice? Because even if you are doing crowns, you're certainly not doing them in 3 hours in a practice environment, right? So making that jump to, what is a practice environment, and also kind of anticipating what is the future of practice environment, because that may be 3-4 years ahead of you if you're in your first 2 years of dental school. That's what we should be sort of teaching to and shifting to the teaching model too.
Yeah, that's one of the things that I've always noticed is there's such a big gap between what you learn in dental school and what the actual market is like, right? It's such an interesting thing. Like, neurosurgeons, when they come out of medical school, they enter into neurosurgery residency. We don't really have that luxury. It's an option to go into an AEGD or a GPR or something like that, which is something that I've always thought maybe like the next step for us in dental education, having mandated residencies, maybe not in the hospital setting, but maybe something in a practice setting. I don't know if that's ever something that has ever crossed your mind or if you've heard people think about, but is that kind of where the trend of the field would be going, or would it be just more emphasis on those broader scope things in the dental school classroom?
Yeah, it's an interesting question that I think about a lot, especially as I have some, roles with dental schools, various dental schools today. And I think the more that we can, the first gap is getting them in the dental practice. The more that we can do that, the better they are acclimated to the different roles of a dental practice, right? And by the way, it isn't just about the patient roster, right? We get very obsessed, even in after dental school, right? As clinicians, those who are into practice ownership and practice building, and the DSOs, which are, account for some 28% of the industry right now. Where it will stop, nobody knows, perhaps 40 to 60%. So it's significant, right? But one look at that is, kind of understanding, well, so then what, right? I have to understand how to practice like that, right? I have to understand how those operate. And it isn't just about the four walls, the ceiling, and the patient roster, right? It's also about the tech inside your practice. Mm-hmm. That's stuff and understand. That's stuff you should have a role in shaping, or we see things like Smile Direct Club come out and try to skate the doctor, right? Or we see people come from other fields and sort of tell the self-regulating dental industry how to do dentistry, right? So, one part of this is whether you're going to be, kind of in a DSO or in a private practice environment, and DSOs are a growing, trend. You really need to understand beyond the scope of the walls and the roster, what are these other major components? I'll give kind of another answer to this question too, which is dentistry, the industry, right? And the whole system, they train dentists to be, and I'm going to quote my friend here, Paul Vigario from Surf CT, a company I greatly respect. The industry trains providers, inclusive of the dental school process, to be operators, right? We graduate as operators. Here is 32 teeth. Here are a certain set of procedures to do on those 32 teeth. Go and operate, right? And this is part of the reason the DSO evolution came along, not just because private equity realized that leverage buyouts and can get good returns on dental practice scaling and selling, but they realized that many dentists want to just be an operator. There's nothing wrong with that, but you have to understand that is one type of dentist. It's not every type of dentist. Right? If you're in the other 40 to 60% of the dental field that is going to remain in private practice, whether you have multiple locations or not, whether you have a large clinic or a small one, whether you're specialized or you're general, it doesn't really matter. What you're building there is a brand, right? It's not just a patient roster with four walls and your subset of procedures, right? You are building a brand that you need to stand behind. And that brand requires, if it's going to be successful, it requires, I'm still kind of quoting Paul here, is you need to be able to think outside the box. You need to be able to capture people's attention, from everybody from your staff to your patients, and you need to leverage that to drive compliance, right? If you want people to be attracted to your brand, them coming to you, right? That's your business working for you, not you working for your business. That's your customer coming to you, not you going out and getting your customer, mm-hmm. right? To be very candid. Mm-hmm. And you want to practice dentistry the way you want to practice it, right? Not the way a DSO wants you to practice it, or the way that a partner of yours wants you to practice it, or the school that taught you wants you to practice it, or the insurance company wants you to, the way you want to practice dentistry. Then you need to build a brand that gets attention of all the stakeholders in the process, and it drives compliance, meaning it gets them to do what you want them to do, mm-hmm. because they want to, right? And I think you're seeing also a generational shift here that, you see younger generations, right?
Yeah, that's totally different from what we learn, right?
Correct.
Like the idea, it's super sage advice. I really appreciate you saying that so that everybody can hear it, because it's something that I've had to learn over the course of a decade. but that in and of itself is not what you learn in dental school.
No,
You learn to be the best at what your field and at your field and the best at what you do, and then hopefully people will come to you. But that's not the case, right? It's about building a brand, and part of that should be being the best at what you do.
Yes.
But it's only one component of it, and so I think that's something that most young people need to hear. Honestly, I think a lot of dentists need to hear. I don't think that everybody's taking that advice. That being said, one of the things that you touched on was just the whole DSO penetration, and I think that I've heard both sides. It's good for dentistry. It's not good for dentistry. But specifically from your field, from the startup ecosystem, like is this driving innovation or is it holding back innovation?
Yeah, from the startup perspective, it is a huge driving force to innovation,
mm-hmm.
right? These DSOs, they do adopt technology early.
Mm-hmm.
They try them, and then they beyond piloting them, they then use them, they buy them. That's very favorable to the startup company and enterprise sales like that, because you can open up 20, 50, 100, thousands of practices in one sale. You're meanwhile getting lots of feedback. You're iterating and improving your product, right? You're driving early revenue. You're working out the kinks around implementation and adoption, right? And you're able to scale to other DSOs. And it's actually very difficult to go to single practices out there,
mm-hmm.
right? The other 70%, right, of dentistry is relatively fragmented. It's hard to get to everybody else.
Mm-hmm.
So from a startup perspective, it's really consuming it. And as the DSOs grow, more and more DSOs, more and more practices, right, more and more private equity investment, they're using and consuming more and more technology. Even in the last few years, when their growth has slowed down, fewer de novos, less acquisitions that they're making, the practices have turned themselves onto efficiency. They call it same store growth, right? And they're really focused in on the best business operations that they can have and clinical operations. And guess what? Technology underpins all that. So they've actually consumed even more technology during a period when they themselves are growing in terms of number of new locations slower. They're consuming even more technology.
Mm-hmm.
So it's a huge pull-through effect on technology and technology innovation.
Mm-hmm. You say that they're pulling in clinics slower. Is that a trend that you're seeing?
That is a fact.
Yeah.
If you talk to some of the bankers out there, our friends at everything from Raymond James to Houlihan Lokey or any of the folks in the middle of the transactions,
mm-hmm.
They'll largely tell you it's been a few slow years.
Mm.
Definitely, practice growth has been far slower than it was, pre-COVID or
mm-hmm.
maybe at the height of 21.
Mm-hmm.
You have a kind of sobering look at de novo growth and also acquisitions. That's starting to come back a little bit now.
Mm-hmm.
Back half of 24 was a little better. Now it's a little better first half of 25. So there's hope here. There's definitely good reason to believe it's going to pick back up. And dentistry is a pretty insulated space. It does rebound very, very well from terrible externalities like multiple sigma black swan events like COVID.
Mm-hmm.
So there's good reason to believe that will pick up. It just takes time. But it has been in a period of much slower growth in terms of number of new locations.
Mm-hmm.
These businesses realize the DSOs, it puts them in a position where they're having a hold, right? Mm-hmm. They're having to focus on same store growth and make all the practices that they have as efficient as possible. Some of them are cutting practices that are really underperforming,
mm-hmm.
right, out of the numbers and selling them off or spinning them out. They realize that they do need to get their, they need to get EBITDA up, right? They need to get their profitability up. They do realize for some of their models that the way to do that is to buy EBITDA, meaning they will have to return to buying practices
mm-hmm.
for those that follow that growth model.
Mm-hmm.
They just can't necessarily do it right now.
Mm-hmm.
Doctors want top dollar. The money just isn't there, right?
Is that good for the doctors though? I mean, I'm speaking speaking as just somebody who doesn't understand the system the same way that you do. And I see private equity taking up all these dental businesses, and you hear the bankruptcy stories from other industries. And is that a different system with us? Is it because we're relatively profitable, even in bad situations? Should a dentist that's being approached by a VC firm have any reservations? And if so, like, how would you counsel them?
Yeah. So, look, it depends on who you want to be,
Mm-hmm.
right? Essentially in your practice. For those dentists who don't really want to, worry as much about the risk of running a small business and, some of the difficult back office tasks and staffing tasks and monetary risk that's to it. And for them, DSOs are a great solution. After all, we don't necessarily get taught, how to run a business in dental school. It's also a great learning environment for those that come right out of dental school, and they get to see high volume dentistry or specific areas of dentistry, or learn from a mentoring system with lots of education around it. It's good in those regards. Also, it's pretty well understood in the space that if you know one DSO, you know just one DSO, right? There really is not a generalizable rule here. They practice with, even with the relationships with doctors, there are a lot of different DSO models in terms of who owns what percent. If the DSO grows and raises more money, more private equity, it has a recap event. They have different models under which the doctors can get a first bite versus a second bite versus even maybe a third bite at the apple, right? And take chips off the table. Versus owning a very minority percentage, or really having the majority of their exit happen in one transaction. There are a lot of different models out there. So it does depend on what it is that the provider wants. They want to stay in this organization and help it grow. Do they want to take other roles outside of their practice within the organization and help others within the organization grow? Do they want to get through the transition and move on and do something completely different? There's no right or wrong answer there, but there are different models for those different career trajectories. So I always tell students, even pre-dental students, right, we should be building the mindset. The application to dental school is not just in isolation and vacuum an application to school. It's not just an academic application. It is a career application, right? You are making a decision about your short-term and long-term career, because even dental schools have differences among each other. So you should think, pre-dental students should be thinking, right, not just about their pre-dental requirements, right? Did I take bio with lab and what did I get on the DAT? They should be thinking, what do I want to do when I graduate from dental school? And then after doing that for 2 to 5 years, what am I going to do after that? Right? They should really have a thought about that and make sure that they get that in their education during the dental school process and or outside of the dental school process where it needs to be supplemented or doesn't currently provide that. But they should be thinking career and not just, kind of a one-track mind.
What about those dental students that are like you, that had an entrepreneurial mindset and have an idea for the next quip or the next, company that is meant to push the field forward? How would you foster that? How would you support that student?
Yeah, no, I think it's super important. I think we often talk about dentists as sort of part doctor, part artist, part engineer. I think we hear that a lot. To me, they're also part entrepreneur, right? And I think that's a critical component. The way I did it, and during the time when I was in dental school, is first of all, I started an incubator. So I started a company, and I was working to help advise other startups. I was helping them to understand the lean startup methodology and running their business leanly, and finding and working with talent, very affordably. I helped them recruit funding. We're in Boston. It has a ton of healthcare funding. We helped them to get vendor relationships that are otherwise expensive for them, a graphic designer, a lawyer. So I was getting it by doing it, right? You learn a lot of business by doing it. After dental school, when I graduated, I went to UChicago's Booth School of Business. So I got an MBA. And so I really learned it, and that opened up a lot of doors for me, especially in terms of how I kind of leveraged the program to continue to build the incubator. And then after that, and after practicing, I started to kind of shift my career towards doing, more and more work with startups and ultimately venture capital. The answer to a student is, and I know it's tough during dental school because it's a very intensive, 4-year program that is highly condensed, but you got to find that opportunity to, intern with a startup, right, or advise them in some capacity, At Tufts, the Polsky Center is, I'm sorry, at Tufts. At UChicago, the Polsky Center is an example of an entrepreneurship department that works among the other schools. Tufts has that too. You may need to ask Dean Karimbuks or others at the school, about how to tap those resources and, how do I get involved in, something going on in terms of, incubation or startup competition, right? There are faculty members like Dr. Yellick, who you mentioned, who are innovators, right? Who are related to the Tufts community and alumni base. Dr. Arsenault, another one with a huge patent portfolio. There's many out there who do know how to innovate and form a company. You just need to find those people and take on a mentor, perhaps among the community.
I think one time we were talking last time we had met, and you said that the chain of dental practices model is very different from a startup model that you had been accustomed to, like building a company like Quip, right? And that one's much more similar to like a restaurant franchise. And then, this is something different. Tell me about that different aspect, because like I feel like that is much more going to drive culture as opposed to the restaurant franchise model, right? That's two very different fields of industry. And it wasn't until you said it that I saw the difference between the two. And now I realize that the really excellent products are changing the way that we live. And can you just comment a little bit about that and what the differences are for somebody that's might be listening to this, that might be thinking, I have a great idea for a product, I just don't know how I market it, or something like that.
Yeah, absolutely. We have been interchangeably, even here in our conversation, using words like startup and entrepreneur, to mean more than one thing, and they do mean more than one thing. You can be a startup and an entrepreneur who starts a practice or buys a practice and grows your practice.
Which is
larger.
The traditional model.
It's a traditional model, and that is being a startup, and that is being an entrepreneur. And you can very much grow and scale that to be a very successful business. That is a services business, right? You're in the business of providing a service to your people, and all of your staff are providing a service, and all of your overhead and expenses are geared around supporting and providing that service. Right. That is one type of business, like a restaurant chain, right? Or other brick and mortar businesses, quite frankly, any of them. It's a very different thing to build a product, right? So kind of differentiating, right? Or even if I say service on this side, I don't mean a licensed professional service like dentistry or healthcare. I mean, providing some other form of business service, right?
Like
non-healthcare.
A subscription service for
a subscription service,
a salivary test or something.
That could be, right? So in this case, in this type of a company, it really starts with an idea. You go through an ideation process. There are structured frameworks to do that. If you don't know them, there are books on them. If you're not comfortable with the books, there are resource centers all around, inclusive of Boston, from Mass Challenge to, plenty of incubators and accelerators that are around. And you're going through what we sometimes call design thinking or an iterative design process, right? So you start out with an idea, and you, in the most basic way, you sketch what your thing does, right? You take it to your key stakeholders, whoever they are, right? To other dentists, to other types of manufacturers or distributors or patients or whoever is your target audience, and you get their opinions on it. This could literally be a sketch on a piece of paper at this point, right? And you change your sketch on the piece of paper 1 time, 2 times, 3 times, however many times it takes to better define that your product and how it's solving a problem, right? After you're done there, you go digital. Right, you digitally mock that up, whatever that means, whether it's 2D or 3D reconstruction, but some digital mock-up of your product. Again, you go back to stakeholders and you're iteratively improving that. Right, all the meanwhile, you're understanding that problem. If you're really solving it, you're understanding the product market fit as you go here. Right, from digital, you go and take it to a prototype. Right, you do this by either very simply building it out of easily accessible raw materials, or you're, 3D printing it or something of that nature, you're again going back to your stakeholders, you're getting their opinions on it, you're tweaking it, you're changing it, right? And then ultimately you start going to, levels of minimum viable product, right? And minimum viable product in a healthcare sphere is pretty high bar, right? Because you're not going to use something that is any bit unacceptable, right, on a patient. And so you have to go through that process, and it's extremely, not that dentistry isn't people driven, but it's people driven in a way that they need to be doing different functions here to help build your product, right? It's very product market fit driven. They really have to be understanding, how does that product fit in the market, right? How is a consumer going to use it? Does it really solve the problem in the best way? Is it defensible, right? So you're really driving and building this product market fit business, right? That is quite a bit different ultimately, right, than
service-based brick and mortar.
Yeah. So for a nerdy science analogy, sometimes cells start out undifferentiated, right? Same kind of molecular structure at that level, but then they go on to differentiate quite a bit differently, right? That same dentist entrepreneur startup idea can go all the way down the path of building, 1,000 location DSO, or they can go all the way down the path of building a product that's used by, 20 million users of whatever type. And that really started as the same dentist entrepreneur who both had an idea for a business, right, but followed a very different pathway in terms of how they got there. But it really starts on the technology side. It really starts with that idea.
Wow.
Right.
Man, that was such a good way to put it, which is the differentiation of those two cell lines. That was something that I understood, Listen, I feel like I could talk to you forever, but we do have to come to a close. The last question that I wanted to ask is that you see a lot of these people that are in industry or that are leading the field have this pedigree of Tufts, right? Our ADA president, Rich Rosato, came from Tufts. You came from Tufts. Like, there's like a lot of people in the ecosystem that are here. Do you have any thoughts on the secret sauce? Like, what is going on at our dental school that's so good and should be promoted? Because there's something here, like what Karen Bucks always says is that, we're making the world's oral health leaders, and I see it, right? It's something, I don't know if it's just confirmation bias, since like I have a red car and then all of a sudden I see all red cars, or if it's truly that way. But a lot of people that I feel like that I've talked to do feel like there's some sort of special sauce. Do you have any thoughts on that?
Yeah, so sort of from the industry side of things, I can certainly validate. I come across a lot of forward-thinking Tufts alums, right? They are out there in the industry doing some really exciting things. As I reflect back on my own education there and what I know of Tufts, first of all, you have excellent leadership. You mentioned Karen Bucks. He's very forward-thinking and progressive in terms of deans out there of dental schools, and so is very accepting of students that want to pursue alternative career paths within dentistry. So I think that's a really strong sense of leadership and example being set there. I think that we get into the clinic early. And students are really motivated to spend as much time as they can, as early as they can in the clinic, and that's how you're going to really pick up how this space operates. So I think that's a really strong aspect of it. I felt we got a great education in healthcare as a whole. My class dissected bodies head to toe, front and back. We had education on all the different systems of the body, from a histological level to a physiological level to a gross anatomy level, right? So you do really learn medicine here in addition to dentistry, and I think that's a huge component of it. So where is there white space opportunity here for us to grow? Tufts has a lot of other schools outside the dental school that are doing some pretty exciting things as well. So I think we can collaborate among schools and bring the dental school closer to that collaboration. And I think from business to medicine to the other schools that are there, I think there's some really interesting things to be found there. I think getting students into, dental practices earlier is a big opportunity. I think introducing students to technology, different types of technology that you're going to face, right? I've got news for you. The practice management system is not Axiom, right? Which we used in dental school in the private practice. So you better know how to use Dentrix or Open Dental or Denticon, right? When you get to practice, that's a big learning curve that can be taken up front rather than down the road.
Yeah.
For example,
we didn't. They're still using Axiom, by the way. Just FYI.
Right. And just as an example, right? And in dental school, we never used a triple tray to take an impression, right? We set our own teeth. None of this happens in private practice, right? And so in order to kind of shift that role of the profession, gotta go there. We got to lean on the leaders that come from Tufts, and there's many out there, and many of them I'm friendly with or have been involved with at Revere. Kathy O'Loughlin is a trustee of Tufts. Kathy was a tenure executive director at the American Dental Association, is a venture partner and LP at Revere, extremely forward thinking and from the Tufts community. Another close colleague and friend is Dr. Sulman Ahmed, and he's the founder of a great and large and growing DSO with exceptional backing.
I tried to talk to him on the podcast, but my flight got canceled. So Sulman, next time.
Coming for Sulman. But these are people who set an example, but they make themselves accessible. Right. I've never known or seen, they are busy people, right? So I don't mean to expose their schedules here, but they are very accepting and supportive of the Tufts alumni and community. And I've never known a Tufts alum to not be accepting of a student coming and, taking a look at their practice or, understanding their business or business perspective. And so I very highly recommend that as well.
No, I think it's all of those things. I think also part of it is just the city of Boston, you're surrounded by innovation. It's like so infectious here, right? And also, there's something about just like the building itself, and you're crammed and I didn't go to dental school at Tufts. I went to the University of Florida, and like we're very much segregated, and here it's like all in one building. And, although the specialties are different, everybody's kind of jumping around from one floor to the other. So I feel like it's a very collaborative environment, but very interesting to see like all of these people that are doing amazing things have this pedigree, So kudos to all of you guys who are graduating this year. And also thank you so much to you, Jeremy, for joining us. As always, it was interesting to hear your perspective. Hopefully you guys got some information about kind of the business side of dentistry. And for more episodes, feel free to tune in to the Dental School's Continuing Education website, where we're always posting these podcasts. And if you don't mind hitting like and subscribe, we would really appreciate it. Thank you so much, everybody. Thanks, Jeremy. Have a good day, everybody.
Thank you. Have a good day.